Thank you and welcome back. Today, our guest is Professor Dr. Sanjiv Kumar Singh, MD, Professor, Department of Repertory at GD Memorial Homeopathy Medical College and Hospital, Patna. Right from the beginning of the career in homeopathy, has been associated with great discoverer Dr. B. Sahani, and under his guidance has made remarkable achievements in grasping the philosophy of homeopathy and work for promotion and discovery of transmission of homeo drug energy from a distance. Besides these clinical activities, he is involved in teaching repertories after his post-graduation degree in homeopathy. He is widely traveled person in quest of enriching his belief in homeopathy. Then the participated in various national and international seminars. The topic is role of Kent's observation in potency selection in homeopathy. Very substantial topic, this makes the difference of this great science, homeopathy, from the all contemporary medical sciences. On behalf of IFPH, I welcome Dr. Sanjiv Kumar Singh. You can have the platform for the next 45 minutes. It's over to you. Please proceed, sir.
Thank you so much, sir.
I would like to add, sir, Dr. Sanjiv Kumar Singh has been elected as the president for HMI, Homeopathic Medical Association of Bihar. So he is presently the president of HMI Bihar.
Yes.
Thank you, sir. Thank you so much.
Dr. Sanjiv.
Yes, please.
You can continue.
Okay.
Yeah.
So now I can share my screen also, na?
Yes, of course.
Okay.
You have made him the co-host, sir? Yeah. Okay.
So thank you so much. First of all, I would like to thank IFPH and team of the IFPH who has given me opportunity to share my knowledge and views regarding the homeopathic experiences of mine. And I would like to thank Dr. Sahani, sir. He's my guru. And in front of him, it's a very big opportunity and a blessing of Dr. Sahani that I'm presenting and sharing my views regarding the potency selections. And especially I'm going to add about and talk about this Kent first observation and potency selections, how this first observation is very relevant in selection of potency. So I'm going to start my presentation. So topic is relevancy of Kent's first observation in potency selection, choosing the potency. Now, there is any teaching which will help us to choose the best potency for a given case? This is a biggest question, I can say, for all the homeopaths and especially the newcomers to the homeopathy. We used to face, because I'm in teaching, and I used to face students and newcomers, new doctors ask that how to select the potency. If I'm able to select the medicine on the basis of totality of the symptoms and after doing the proper case taking, this is the biggest problem to select the potency. It is like unsolved puzzle since very beginning, I can say. Yeah, since I am in 32 years, I have already crossed in homeopathy. And still, I also feel sometimes that what potency should be prescribed in this particular case. So still, it's a like unsolved puzzles. There is little teaching, but many opinion. Yes, so many things are there. Teaching is there, criteria is there, points are there. But in spite of all those things, it differs from person to person. Means doctors to doctors, it differs. What potency should be prescribed? It varies according to the practitioners. Some are using low potency, some are working with high potency and very high potency. But when we go through some stalwarts like boric, no, and I have already gone through that, the boric materia medica, and I have found that most of the cases and most of the medicines in the last in the medicines, boric had provoked about the lower potency, 6, 12, and 30. Hardly I have found 200. But nowadays people are using 1M, 10M, and more than that. So it's a very big issue for the the potency selections. But stalwarts has already talked about the lower potency, and many of the doctors nowadays also practicing with the lower potency. Few days back, one of the students came from the village and he was talking about the lower potency, that villagers are very simple, very plain. No, the life is very simple. So I used to give low potency and it is very, very good, working very good over there. So it depends. So it is about the potency. Gonse has said the series of potency had been compared to the gamut in music. A skillful artist may indeed construct a harmony with the various vibrations of the same chord, but what a more beautiful and perfect harmony might be constructed by a proper combination of all the sounds that can be elicited from his instrument. Yes, this is very important. A skillful artist means a skillful doctor can adjust, like, no, the fine tuning, it is like that. So the fine tuning of the potency is also very important, and this will come only after the experiences, the clinical experience. So the doctors, those who have lot of clinical experience, lot of teaching has got from the seniors, they can do like this, they can tune the potency very nicely, because it depends, it varies person to person. Like the medicine is in homeopathy, medicine is varying person to person. So the potency selection, the dose selections, this the posology, it also varies. But the skillful artist means the skillful doctor, they can adjust the potency also very well. In general, it may be stated that any curable diseases may be cured by any potency when the indicated remedy is administered, but that the cure may be much accelerated by selecting the potency or dose appropriate to the individual case. This is also one of the statement, and I think this may be misleading also, that if you have selected the potency on the basis of totality and right medicine you have selected, but it is not sure that that medicine is going to cure. But some people think like this: if the medicine has been selected on the basis of totality, whatever the potency will be there, the disease will be cured. I don't agree with this. I don't agree, because selection of potency is very important. And why I'm talking about this? Because Kent has already taught us in first observation, which I will go through. No, but some of the teachings, some of the schools, they are talking like this, that if you have selected the medicine properly after the proper case taking, whatever the potency is there, the disease will get cured. And if you are giving proper potency, it will accelerate. Yeah, this is true, it will accelerate. But it is not needed that potency selection is not correct, then disease will get cured. So we'll have to be careful while selecting the potency and dose. Though there is few rules and regulations for it, guidelines are also available. So we are going through some of the guidelines which we have gone through. So many the stalwarts and the experienced doctors know, they have given some guidelines. So we will go through that, and I hope that most of the people have gone through all these points. So this 5 point is very important. After that also there is so many points. So 5 point is very important. The first one is the susceptibility of the patient. We all talk about the susceptibility, for the all sorts, all type of the patients, male, female, children, old people, and everyone. Susceptibility. This is also very important. Second point is the seat of the disease. Where is the seat? These are the very common point. The nature and intensity of the disease. Yes, what type of the nature is there, and the intensity of the pain, intensity of the pathology, and everything. Then the stage and duration of the disease, since how long the person is suffering and in which state. Nowadays, through the pathology, we are trying to find out, and we are able to find out the stages of the disease, the grading of the disease. So stages and duration, this is also very important point. On the basis of that, we can select the potency. Then the previous treatment of the disease. Yeah, this is also very important point. Previous disease, previous treatment, because we have in our repertory, in general, a very important rubrics for the previous treatment. Like someone has taken a lot of allopathic medicine, we have rubrics medicine allopathic abuse of. In synthesis repertory we have, and so many good medicines are there, including Nux vomica, sulfur, sepia, and other medicines are also there. So previous treatment is also very important. In that case also we can think about the potency as well as the medicines. Even for the treatment of the homeopathy, we have rubrics remedy and two sub rubrics is there. Remedy, failed to act, well selected remedies, and violent reaction of the remedy. All these three rubrics you can find it in synthesis repertory in general chapter. So the previous treatment is also very important for the selection of the potency. In spite of all these, other points are also there. Certain factors for selection of the potencies are, first one is the disease potential. Disease potential involves various factors. The first one is the value of the symptoms. Value of the symptoms, what type of the symptoms is there, and we should evaluate the symptoms according to the disease, according to the patients, according to the personality of the patients. So the value of the symptoms, value will decide on the basis of the patients and incorporation of the presentations. So the value of the symptoms is also very important. Nature and seat of the disease, where disease is there and what type of the nature of the disease is there, this is also very important. Then the tissue affinity, how much involvement of the tissue is there, what type of the involvement is there, tissue involvement. Then the pathology involved, what type of the pathology and in which level the pathology is there. This is also very important when we are talking about the disease potential. And the fifth one is the duration of the pathology and its a pace. This is also very important. Duration, the time factor is also very important for treatment of any sorts of the disease, whether it is acute or chronic. So the duration of the pathology is also very important, and pace of the diseases and the pathology is also very important. The second point is that the sensitivity and susceptibility. What we have already talked about, the susceptibility and sensitivity. Sensitivity and susceptibility are denoted as high, moderate, and low. In three categories, we divide it: high, low, and moderate. High sensitivity shows a high level of reactivity. So on the basis of this presentation also, we can think about the potency. Then the miasmatic interpretations. Which miasm is prevalent and dominating? This is also very important. And what type of the symptomatology of that particular miasm is there? So on the basis of that also, we can think about the potency. Similarity, degree and level. Then the suppression and type of the patient. So type of the patient means as a whole. We talk about the individuality in homeopathy, So if we are talking about the patient means as a whole, the present symptoms, past symptoms, family history, mental, physical, environmental, social, economical, everything, including everything. Patient, if we are talking about the patient, means everything. So on the basis of that also, so all together. These are some indications for the high potency. So some of the points are there. More characteristic symptoms, we will go for the high potency. I have gathered so many information from various sources. So more characteristic symptoms, we used to talk about the high potency. Higher the similarity, again high potency. High susceptibility, high sensitivity, high immunity, acute diseases, reversible diseases, functional diseases, and mental diseases. In all these points, we can think about the high potency, and usually doctors are preferring to prescribe the medicine in high potency in these particular things. So just opposite to this, the more characteristic symptoms you will find for the in the low potency, less characteristic symptoms or paucity of symptoms. The less characteristic symptoms or paucity of symptoms, of course, if there is paucity of symptoms, we are not able to find out the symptoms during the case taking. Definitely the characteristic symptoms or whatever the symptoms will be not presented over there. So in this type of the situation, of course, we will think so many times that what type of the what type of the potency should be there, what type of the dosage should be there, because we are not able to identify, because symptoms is not there. So the paucity of symptoms, less characteristic symptoms, lower the similarity. Of course, if the symptoms is not there, how we will construct the similarity? Low susceptibility, symptoms is not there, so we will not able to decide the susceptibility. Low vitality. So everything is depending on the symptoms and symptomatology. This is the reason behind that the paucity of symptoms had been mentioned above. So all these things, the characteristic symptoms, similarity, susceptibility, vitality, immunity, all these things, all these points are depends on the symptoms. And if we are not able to get the symptoms, then definitely all these things will be not visible. So in this type of the things, in this type of the situations, we should not think about the high potency. We should always think about the low potency, because we are not clear. No, we are not. It's a vague situations. So in this type of the situations, we should not go for the higher potency. And chronic disease, as we have already gone through, know that the in acute diseases high potency, but in chronic diseases low potency. Irreversible diseases, of course, if there is irreversible changes has been taken place, we will not go for the higher potency. And then the advanced pathological cases, pathology has been taken place, so we will go for the lower potency. Some of the more points is there: involvement of the cellular tissue or muscular system, organs of locomotive and circulatory system. This is for the low potency I'm talking about. So organs of locomotive and circulatory system, extremely weak, old, or very hypersensitive subjects, oversensitive, idiosyncratic, and weak constitution patients, dull, backward, sluggish, and unimpressionable patients, lymphatic temperaments, oversensitive to drugs, engaged in physical work, incurable cases where only palliation is aimed. So in these situations, we will go for the low potency. And just opposite to this, we will go for the high potency again. Involvement of the cutaneous, mucous tissues or nervous system, organs of respiratory and nervous system, children and young vigorous persons, children and young vigorous person, intelligent, sensitive patients, neurotic patients, melancholic, nervous, and choleric temperaments. Poor reaction is there, then we will go for the higher potency. Engaged in mental occupations. So in this type of the situations, we will think about the higher potency. Some other indication is there for the high potency is that the functional remedies, SORA and psychosis, acting on mental level, nosodes, inhabitants of warm climates. This is very important that the nosodes, most of the people think and prescribe nosodes. I have also seen so many doctors that they are talking and practicing the nosodes with the high potency. They always talk about the nosodes that whenever they think about the nosodes, they say that the nosodes should be given in the high potency. But my opinion is quite different. It depends because so many points are there, no? So nosodes is also the medicines. If we are talking about the remedy, nosodes does not something different. This is also medicines. So medicines should be prescribed on the basis of totality of the symptoms and all these points what we talked about, no? So considering everything and considering the philosophy of the homeopathy. So it depends. Indication for the low potency again, nutritive remedies, tubercular miasm, acting on physical level in temperate and colder climate. Temperate and colder climate. So these are the points on which we can think about the higher potency, on which we can think about the low potency. In spite of all these things, no, all these stuffs, it felt difficult. All these things, so many points are there. Teaching is there, schools is there to teach about no how to select the potency and all. But in spite of that, because something which is missing, we are no like no tools is there to measure the susceptibility. This is the biggest question. We are talking about the susceptibility, we are talking about the sensitivity, but there is no tools to measure the exact susceptibility and sensitivity of the patient, intensity of the disease, intensity of the pain and all. There is no tools to measure all these things. Only on the basis of symptomatology, and the basis of symptomatology, we are assuming that the susceptibility is on this plane, the sensitivity is on this plane. This depends, this measurement is also depends on the individual. This is the biggest problem I think we are facing in homeopathy, because we are talking about the susceptibility. We know about the susceptibility, sensitivity, intensity, everything. This is the male, for the male higher potency, lower potency, female higher potency, for the children high potency, old people low potency. So many things are there. But all these things, the vitality, how to measure the vitality, how to measure the susceptibility, this is the biggest problem. But something should be there, no, something should be there. And already we have, it does not mean that we will not think about the potency, we will not think about the all these points. So in spite of all this paucity, in spite of all these problems, we have the way out to select the potency and dosage. So now what to do? Kant's first observation. Kant's first observation, this is very important, which I have gone through and which I have procured through this observation. The first observation is that the prolonged and final decline of the patients. Prolonged and final decline of the patients. We all have gone through this. Prolonged and final. Why? This is very important. Prolonged and final decline of the patients. The meaning is that the medicine may or may not have been a correct one, but surely the potency was very high. This is very important. This line is very important. The medicine may or may not have been a correct one. So we can say, okay, our medicine selection was perfect. It was correct, but surely the potency was very high. This is very important. And the medicine was deep acting anti-psoriatic. Therefore, instead of helping, it has established destruction since there have been enough irreversible tissue changes. Nowadays, so many people are starting the medicine with 1 m or 10 m. I have seen so many doctors, they are practicing with the high potency and they are directly starting with the 1 m. We are using LM potency, myself using LM potency. I'm starting with 0 by 1, 2, 3 ladders. In a ladder scale, it is there, no? But those who are practicing with the LM potency, they are also starting with the high, like the 0 by 10, 0 by 11, something like that. So I have seen so many doctors, they are using the high potency. So it has been clearly mentioned the medicine may or may not have been correct one, but surely the potency was very high. So Dr. Kent had told he was sure that the potency was very high if we are getting this type of the situation, prolonged and final decline of the patient, means the patient is going to die. The aggravation is there and the final decline of the patient. So this is the meaning of the first Kent observation. And duty of the physician is what? It necessitates immediate antidoting after recasting a more similar medicine in low potency. Again, this is about the potency selections. So necessitate immediate antidoting after recasting. Yes, this is very important. We should go for the recasting and all, but already patient is going to decline. No, the final decline has been already taken place. So a more similar medicine in low potency is to be prescribed. This is also very important line over here. High potency should never be used in chronic and doubtful cases. Just we have gone through, no, where the paucity of symptoms. The paucity of symptoms means the doubtful cases. Where there is less characteristics, doubtful cases means the doubtful situations. So in doubtful situations, if we are not sure that this medicine is going to cure the patients or we have not gone the totality or the personality of the patients, we should not go for the higher potency. So potency should never be used in chronic and doubtful cases. So according to Emil Tyler, begin with 12 or 30, especially where tissue changes may have occurred. Emil Tyler has also told about the potency selection. 12 or 30, not more than 30 he is talking about. So most of the stalwarts, they have not talked about the 200. Rarely they have talked. And just I have told, no, the boric, I have seen in boric materia medica. I don't think that so many seniors doctors are sitting over here. And I think most of the people have not seen the boric had talked about or provoked about 1 m or 10 m. Hardly we got it. So 12 or 30, especially where tissue changes may have occurred. So the most important thing is that the counting start with 1. Yes, this is very important. So on the basis of this first observation, we are finding that the lower potency should always be start, especially in chronic cases. So the most important thing is that the counting start with 1. We all know so many opinion is to start with low potency, especially in chronic cases. In acute cases, if tissue destruction had been taken place, low potency will be better. Yes, this is my opinion, and I have seen the cases also. In acute cases, I have already presented the slide over here, and it was written in high potency that if the person is suffering from the acute disease, we should start with the high potency. But if the tissue destruction has been taken place and the gross pathology is there, in acute cases, we should also start with the lower potency in acute diseases also. High potency in acute diseases, yes, it is correct. I have also seen, I have also used, but where there is tissue destruction had been taken place, where there is pathology is there, the gross pathology is there, in acute cases, we should not think about the high potency, especially in the pneumonia. One case I have remembered, Dr. Sani also knows, one of the bankers in 2021, Corona Kal, no, during the Corona period, uh, he telephoned me that my mother is got infected with corona, and she was around 80 years old, and she is having the symptoms of corona like the cough, fever, and throat pain, everything. So I am giving her, the paracetamol, and then this azithromycin, and the fever is going on and coming back, like this situation is there. So what should I do? So we selected the medicine, and the medicine was anti-MTAR. So I started with 0/1 potency. After 2 days, all of a sudden, in the morning around 8 a.m., he telephoned me that the condition of my mother is very bad and she is on ventilator. I asked him that what happened. So he said, my brother, he is in Delhi, and he's working in a bank. So he suggested me arsenic album is very good remedy for the corona, and so many people are taking, and spidosperma also. So better to give this arsenic album, and I got it from the market. And so I asked, what potency you have given arsenic album? So he said 1 potency. Arsenic album 1 potency. So I asked, who suggested you? Again, he said, my brother. So I asked him, what your brother does? He said, my brother is in bank, but he has good command in homeopathy. He has so many materia medica, and he has deep knowledge of the materia medica and all. I was shocked, no? This is the biggest problem. People think that if I have knowledge of the medicines and I have gone through the symptomatology of the medicine, this is enough. This is enough. No need to go in details of the homeopathy. No need to go in details of the philosophy of homeopathy, organon of medicine, Hering's law of cure, 12 observation, nothing. Simply they are thinking that I have gone through so many materia medica, boric materia medica I have, Kent materia medica I have Ellen's materia medica, and I know everything. And finally, her mother died. She was on ventilator, and finally she died. This is the biggest problem nowadays we are facing, especially with the newcomers also. They are not focusing over the other philosophy, the principle of the homeopathy, the Hering's law of cure, the 12 observation, and all these things should be incorporated. If we are not incorporating all these things, it will become very difficult. So the potency selection is very important aspect in homeopathy. And I used to tell to my students when I go to the college and all, know, and doctors come to me, keep the first observation in your mind. Start with the lower potency, whether it is chronic or whether it is acute. But in acute condition, definitely we should go for the higher potency, but we'll have to keep in our mind that if tissue destruction had been taken place, we should start with the low potency in acute cases also. So this is very important, the relevancy of the first observation in potency selections. I think I have gone through all these points. So thank you so much for patient hearing.
Yes. Nice presentation. At the last, you mentioned the point, most important, deep
Yes, sir.
knowledge on materia medica is not at all the sufficient or what is required. We should have a strong philosophical background. We know that
Yes, sir.
the
Yes, sir.
textbook of Material Medica by Carol Dunham and Dr. Ken is totally different from all other Material Medicas.
Yes, sir.
Because we two people are expert in the homeopathic philosophy. So
Yes, sir.
without having such philosophical base, homeopathy is not conceivable. So it's time for discussion. Those who would like to participate, please raise your hand.
Yeah.
You mentioned about of the 12 observations, the first observation itself is that much extensive. That indicates that how much is the homeopathic philosophy, how deep it is.
Yes, sir.
Then you said about this, there is little teaching, but only opinions. That's the most important thing. And later now, Dr. Sridhar sir is there. Sir, please, you can unmute now. Yes, sir. Please proceed.
As a terminal case, sir, that what about your terminal case, example, cancer and diabetes, etc. in the terminal case, last stage, which potency you suggest?
Sir,
Lower potency, I feel the lower potency.
Yes, sir. Lower potency. In terminal cases, we go for the lower potency.
Okay.
Yes, sir.
And what about your opinion about the intercurrent and the constitution and the miasmatic remedies? What are the potencies you suggest?
Yes, sir. Intercurrent, definitely. See, the most important thing is the totality. And on the basis of totality, we think about the intercurrent medicine. And because we plan like that, no? So suppose sulfur is there or Nux vomica is there. And if we have think about that some mathematic background is there, then we decide some nosodes should be given. So in this type of the situations, we give nosodes with little higher potency, what we have already prescribed. Suppose I have prescribed in 0/1 potency and I have to prescribe intercurrent. So I will go for little higher than the 0/1, like 0/3 or 0/4. Little higher than the first prescription.
Okay.
What about your opinion about the pressing method? There are some doctors that they are doing pressing method.
Plussing method. Yes, sir. Yes, sir. I also do the plussing method, especially when I'm practicing with this drug transmission. So we used to do this plussing method because it depends, I'm using LM potency. So between 0/1 or 0/2, there is something. So directly going to 0/2, we do a stroke or sometimes we do plussing. So we should go for that also. The plussing method is also very important and it works very nicely.
Okay.
Okay.
Yes, sir. Thank you, Sridhar sir, for joining with us. Now, Dr. Mridul Sahani, sir. Sir, you can unmute now. Please unmute, sir.
Yeah, I'm unmuted now. You can listen me.
Yes, please proceed.
My voice is audible to you?
Yes, sir. No doubt.
Yeah. No doubt what Dr. Sanjiv has presented. It is wonderful presentations. And what he has experienced with the homeopathy is very much classical for the homeopathic understanding. And I agree with all that practicing with the knowledge of the Materia Medica or partial knowledge, the homeopathic practice cannot be completed and cannot be practiced as in the true sense. The true sense of the practical homeopathy comes from the classical and understanding of the philosophy of homeopathy. Philosophy is very important because it is the soul for prescribing and it gives you the insight into what should be prescribed, what medicines has to be suggested, and in what potency. Now, what Dr. Sanjiv has added, it is very, he had elaborated the things in details, but in the Stuart Close language, it is simply, we can summarize it as higher the sensitivity, higher the potency, lower the sensitivity, lower the potency. This thing gives you a nutshell understanding about the use of the potency in different scales. As we see in the higher pathology, the sensitivity are usually lower. So definitely the higher pathological cases, deep pathological cases, in the terminal cases, what Dr. Sanjiv has told, it is very much true that we have to go for the low potency. And highly sensitive persons, highly sensitive. And what we feel during the acute cases, The acute cases, the sufferings are very sensitive. Pain are sensitive, everything are sensitive. So definitely the higher potency are required. And during the COVID time, also we have experienced the use of arsenicum, arsenicum album in 0/7 potency, 8 potency to be working much faster than the lower potency. So these are the things that we have to keep it. And Dr. Sanjiv has rightly said that unless we have that deep insight in the philosophy, organ of medicines, the rules are about the simillimum, and how to select the simillimum, which is very much relevant for the present understandings and the educations. Students should, those who have participated, join in this session, and also to those who are learning in the colleges, they must have the complete understanding, because it is only a sadhana. When you practice, when you study homeopathy, you have to be a dedicated homeopath, and for that you have to be a good learner. And you have to learner means devoted with the devotions. So congratulate Dr. Sanjiv for your nice presentations and coming to our webinar.
Yes, sir.
Thank you so
Once,
much.
sir, what you said about this acceleration of this potency, it will increase the potency, will accelerate the process of cure. Despite if it is similar, definitely will act. If it is the higher potency or the right potency, it will work more quickly. That is the most important thing. Then another is we mentioned about this, the immunity, low potency. Could you please explain that, sir? Low immunity, what do you mean by that?
Low immunity, low potency.
Yes. What do you mean by this low immunity there?
Low immunity means, sir, the person is not able to fight out the situations. The fight out the situations means the weather change is there, having the problem, some temperature change is there, some mental change is there, and patient is so very sensitive. We can say very sensitive. Sensitivity is there, but the immunity is very weak. Sensitivity is there, but immunity is very weak. Not able to fight out the situation. So in this type of the situations, also we should go for the low potency.
Sensitivity and immunity.
Yeah, sensitivity is there. Sensitivity is there. Of course, sensitivity is there, but immunity is not there. This is very important, sir. This is very important. Immunity is more important.
I think it's a personal observation from you, I think.
Yes.
Then
yes,
another one you mentioned about this inhabitants of warm climates require high potency. Sir, what is the logic, sir? What is that? Warm climate. In warm climate, patients below from warm climate requires high potency. Why you said, sir? So,
warm climate, high potency.
Yes, sir.
Yes, sir. Warm climate means that the person is very much prone to get the heat and all. So body is getting heated over there, and the immunity, all the tissue become very active. So in this type of situations, we can give high potency, and the patient will take the medicines, and after that it will work very fast. So if we are giving the high potency, because the dilation of with the warm climate, with the temperature, high temperature, the vitality become very active. Like in the condition of the high temperature, the immunity become very active. So in this type of the situation, if we are giving the high potency, the reaction of the medicine or the acceptance of the medicine will be very high. So in this type of the situation, we think like we should go for the higher potency.
It's the opposite. In the cold climate, your suggestion is to give low potency, isn't it?
Yes, sir.
Yes. So in general, we can say in the European countries, often they have to adopt this medium potency or low potency. Is it right?
Yeah, that's why the Bory, Clark and all, they have already talked about the low potency. They are not talking about the high potency. But right. Especially in our country, people are using in a different way, the different potency. Just I was talking about one of the villagers. They came to me, and doctors, not villagers, doctors from the village. And he said that I'm using the low potency because the people are very, the pure heart, and they are away from the pollutions. The climate is very good. Atmosphere is very good. So the pollution is very less. So I'm giving low potency, and it is working. But in rural areas, they are giving high potency.
Yes, of course. We must remember that first first thing is the first criteria is the similarity.
Yes,
Second
sir.
one dose. The third one is this potency, and the fourth one is the attenuation. These are the 4 points mentioned by Heinemann. If I'm
Yes, sir.
right. Then another point you mentioned about this antidoting. The same medicine with lower potency is often capable of creating some sort of antidoting.
Yes, sir. It has been already told, no, the higher potency is antidoted by the lower potency also. So we think about that. And Dr. B. Sani, father of MP. Sani, used to teach me, no, which is the best antidote. So the best similar medicine is the antidote, best antidote. So on the basis of symptomatology, we can go for that. So if we have given the medicine in high potency, and after recase taking the same medicine is coming, so we can antidote the higher potency with the lower potency.
There is Heinemann mentioned that even we repeat the same potency at regular intervals, the previous dose is antidoted by the new dose.
New dose, yes, sir.
Mentioned, I'm not remembering the aforesaid drug proving just there. That is why when the symptoms started, you just stop the medication as advised Heinemann. This is the logic. Then
Yes.
another we mentioned about this Borix potency selection.
Yes,
I
sir.
think because of the pathological viewpoint or the domination of the pathology at that time, that might have forced these persons to depend upon the low potency. That may be the reason. Sahani sir, what is your opinion, sir? You can unmute now, sir. Please unmute, sir.
Yeah. So what you were talking, Dr. Manoj, was that the same potency, use of the same potency, repetition of the dosage. And what we understand from Dr. Luke D. Sepper's writing, who has made a commentary on the organon of medicines, that potency should not, any medicine should not be repeated. And also we understand that medicine should not be repeated. Now, in the sense that we think that the same potency has worked well, and I have to repeat. Now, when it is compulsory, it becomes necessary, then what we should do? And Luke D. Sepper has rightly suggested about using the flushing method. That means throwing all the water from the phial and adding fresh water and giving a stroke, so that will increase the potency. So this is the upgradation, slightly changed states. It is not the same potency, but the same slightly elevated potency. So this is very much important. This can be, and I have followed the Luke Day's understandings. I have read it in details that he has made a good commentary on the potency selection, Luke Day Seppers. So
there is an interesting suggestion by Heinemann. If you give the 30th potency, then you can the follow-up can be done with the 18th potency, then 12th.
My father used to, Dr. Bisani, what I have observed him during his practice, when he was using Rustox, he was not using the 30 or 200. He was using 500. I never heard that 500 potency is there. And from where he procured it, he told me that he brought it from the Kolkata. He might have ordered it, got him prepared, and he was. So it was his experience. And one thing also, questions always arise. We practitioners, the general practitioners who are using the potency in the centesimal scale from direct 30 to 200. 32. So why this long jump? Is there in between things are there? So and all these questions are being removed by the introductions of the 50 LM potency. LM potency, you have to go slow up, and in between, even within the slow potency, slow progress, you can make your own flushing methods. So this is very relevant for understanding, not to repeat the same potency again and again.
Then again, another important point mentioned by Heinemann is that in case hypersensitive patient, olfaction should be adopted.
Olfaction.
Most important, if the patient is hypersensitive, you must give the medicine in the size of the pop with this mustard seed.
And in original 283 F
yes, sir,
in organ 283 F Dr. Heinemann has mentioned about the methods of application of medicine. And among this, It was the oral medications, tactual medications, and oral. And why he discussed like this? It is not only related to the sensitivity, it is also related to the dynamicity of the medicines.
Yes.
Dynamicity of the medicines.
Yes,
Now,
sir.
homeopathic medicines beyond 12C potency are highly dynamic. They don't have any molecules in them. So how to administer this dynamic substance? It cannot be digested. It cannot be. It can be experienced, and it can be experienced. Dr. Henneman was coming to the conclusion, the scientific city beyond 283, 280 FM, and 283, sorry, 280 to 291 FM. You read them very precisely, and you can understand that this potency. These writings are related to the discovery or finding out the new discovery, new way that can be introduced for the appropriate mode of application of the homeopathic medicine. Appropriate mode.
Well,
so he tried with the olfaction. And
Yes,
recently, I met Dr. L.M. Khan from Kolkata. He's a good friend of me also. So he used to practice in his regular practice using all the patients the olfactions method. And then recently I was talking to Dr. S.P.S. Bakshi from Baxon's College. He said, Dr. Sahni, your method is very true, that you are transmitting it from a distance. What I have observed that I am spraying the medicines to the patient, and as spraying is as good as the olfactions. So all these are the higher the dynamicity, higher the dynamic mode, and to confirm his doubts about the higher applications, Dr. In 291 FIU, Dr. Henneman has compared about the homeopathy with the mesmerism. Mesmerism means from the distance also. So these are the thoughts which can bring you a change in the way you are prescribing, And when you have understood the basic nature of the homeopathic medicines, it is very important. You have to understand the basic nature. And what is the nature? It is dynamic. It has got nothing. It is just like working like a memory, transferring of the memory from one place to the another. And memory cannot be transferred and it don't need any vehicle. No vehicle is required. So the homeopathic medicines are those medicines which requires no vehicles. So it is direct administrations, and it can be touched, it can be discovered, it can be transmitted from a distance also.
Sir, there is another information is about that. When you administer the medicine, Henneman describes the most suitable time for administration of the antibiotic medicine, not an hour before going to bed, but the early morning. Why? Because of the activity of the dynamic activity of the mind and body is more in the early morning.
Yes.
So that's also another strong evidence of this nature of homeopathic medicine.
Yeah.
Then another point is that you don't administer the medicine in water. Dry upon tongue is the hint, is the suggestion given by our master. Because if the medicine is right, if the medicine is a remedy, definitely that will aggravate when you dilute the medicine in water. It is from his experience, and it's also evidence from our own experience. If you are thorough or you are a master in prescribing, definitely you should be more cautious, because that will aggravate.
Yes, sir.
Sir, I agree with you, sir. One thing you may be aware about the chemistry, law of the chemistry, is that the electrons have the free-flowing movement when they are in the liquid state, and in the solid state, the free flow states are not there. So in that cases, in this this is the supportive to your statement that in the diluted state it works more sensitivity. And regarding the morning to be the best time, and people used to associate that it is the mouth is clear and but you have rightly added that it is that sensitivity dynamism is higher, receptiveness is very higher, receptive power. Now we are more receptive, more free from any type of the things during the rest hour, during the night, or during. So those are the best period for applications also.
Yes, sir. Dr. Sanesh,
Yeah, Dr. Dhanesh, why you are silent today?
Yes, sir. It was very interesting lecture from both all of you, and that's why simply listening and all the things discussed were really superb. And using the potency, we used to say that this potency selection must be in proportion to the intensity of the patient as well as the disease. So that, for example, we can give a high potency for children because they are so sensitive and so quick to perceive what we give to them. So these are the things that were written long back, but unfortunately, we people, the common people believe that the big quantity of medicine always goes faster, but it is entirely different. Homeopathy concept itself, a small pellet itself can do wonders. Today, I was traveling with my daughter, and one patient called me in between, and they told me that everything is fine, and she has very good relief. Then I just I give an advice to my uh, pharmacist to give placebos in powders as well as pills, so that the patient need a medicine. But after hearing this, my daughter, who is an MD graduate, MD doctor from other side, asked me, "Oh, why you are not giving medicine to that patient?" I told her that this is the way we prescribe. When we hit a person with a stick and the person is in the right path, then why you are still hitting more and more?
Yes, sir.
There is no need of hitting again and again. This is the beauty of homeopathy. And then I told her that you people are giving so a lot of vitamins in the name of medicine, but instead we used to give this is what homeopathy is all about.
Thank you, sir. Yeah, this is very good that hitting again and again, this is not so important.
Yes,
It supports our view of transmitting the medicines from a distance. We don't have to ask the patient to give the medicine daytime, night time, what time. Now simply let us know what is changing.
Recently, the quantum entanglement theory is also substantiating the homeopathic potencies. The physics, as the science develops, it will definitely accept homeopathy, or it will become more clear to the common man, not to the intelligent persons, but it will be more clear to the common man who thinks in the common language. That's the problem. Then he said about this. This most important thing here is the diet and regimen. We don't forget about that. Why it is advised? Because of the minuteness of dose. That is also an important factor when you administer a remedy, not a medicine, a remedy in the minimum dose. But unfortunately, it wasn't properly followed or instructed. The same procedure is followed in drug proving also. Why? To get the optimum results or the exact symptoms, we need to observe diet regimen proving also. So what we are doing the proving, the same thing is adopted in treating the patient. That's by connecting two series of natural phenomena, as said by Dunham. The natural phenomena of disease and the phenomena proved by medicine. These are connected together by the nature's law. If it become possible, definitely you should follow that also. As in the last point you said about this, the knowledge of having a basic knowledge in the homeopathic philosophy. We can't be successful. It can be accidental cures may be there. What is often happening is that because of the elasticity of the nature's law, a lot of persons are successful.
Yes.
But they are not at all cures. It should be measured with certain criteria. It should start from where to end from where, from center to periphery, above downwards. In that order, if it happens, then only we can say it's a cure. The others are recovery. But whatever may be, the patients are needed. They are asking for results. That's also a very important thing as far as the establishment to establish the system of medicine, the homeopathic science. But we treat behind the pathological principles, definitely homeopathy will suffer. What is your opinion, Dr. Sanjiv Kumar Singh, sir?
Yes, sir. No, you are rightly said, sir. This Hering's law of cure and 12 observation, I have already talked about that. No, that this is very important. If we are giving the medicines, that results should also come according to the Hering's law of cure. If it is not coming there, then palliation is there, suppression is there. Patients are not aware with the palliation and suppressions. So we are saying, oh, patient is getting cured, but symptoms is going there, but the disease is already prevailing over there. So definitely we should go for the philosophy, and the philosophical background must be very strong to prescribe the medicine. And you rightly said, sir, I'm very much impressed that you are always talking about the medicine and remedy. Yeah, this is also very important. Medicine is something else, and remedy means the solution. And solution always based on the totality of the symptoms according to the homeopathy, according to the Hahnemannian principle. So rightly you said, sir, this is very important.
I think homeopathy is a lone medical science which discriminate between medicine and drug and remedy, and also cure and recovery. I think no other system of medicine is ever aware of this basic things, isn't it?
Yeah, rightly said, sir. Rightly said. Drug, medicine, remedy. Three things is there. And similarly, sir, very good.
Unfortunately, the so-called scientific persons with lacks indifference, they are using interchanging this. We gave a drug, we gave a medicine, we gave a remedy. We have a remedy for that particular complaint. It wasn't there. That is totally false.
Yes, sir. Remedy always means solution. The final solution.
It only proves ignorance. As said by George Vidalkas in his Professor on the Repertory, absence of textbooks for other professions means vast experience or knowledge, but in homeopathic profession, it means ignorance.
Yes, sir.
Said by Dr. Vidalkas in the forward of the Synthesis Repertory.
In
the wind-up session, may I invite Dr. Tanesh to make a conclusion speak, as well as vote of thanks to Dr. Sanjiv Kumar Singh.
Thank you.
Yes, Dr. Sanjiv Kumar Singh, it's really a wonderful session. Back to philosophy and back to homeopathy. Even though you presented only half an hour, but the later we have a wonderful discussion.
Yes,
Doctors and Dr. Manoj is also a person. He was a teacher. He's a professor, working as an assistant professor in the Department of Organon itself. And now he is a medical officer in government sector. That's his. He loves that profession much more than what he is doing now.
Yes,
that's why he can say all this much of philosophy and this much of thing. He's a better person to talk to anyone about our philosophy. So we are lucky to have such a Sahani sir was giving.
Before you conclude, sir, I will make an appeal, a small appeal.
Yes, sir.
And that I am repeatedly making appeal for all the homeopaths of our country as well as abroad, that 10th April is going to be a very historical day for homeopathy. As President of India, Srimati Draupadi Murmu has kindly consented to inaugurate the World Homeopathic Day celebrations at New Delhi, organized by Central Council for Research in Homeopathy, National Institute of Homeopathy, and National Commission of Homeopathy under the Ayush umbrella. So I request all to make it make it sure that you all should be present there and express our solidarity for the homeopathy on this occasion. And thank you, sir.
Yes, sir. They contacted us also on the IFPH also for joining the session personally. Anyway, I'm thanking Dr. Sanjiv Kumar Singh for this event, to share this knowledge, and those who participated in the session and those who participated in the discussion. And we can have one more session from sir in the coming days and hope. So
surely, sir.
Thank you all. Thank you, sir.
Thank you so much, sir. Thanks to all.
The precision and time is also very important. IFPH is always very much cautious about that. So with that, Kumar, let me conclude today's English edition, day 1292. Hope you that we will meet again tomorrow. Till then, goodbye. And Dr. Shaila to continue the program in Malayalam.
Okay.